Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Nuzhat Akram. The topic of today's presentation is medical ethics. Under this topic, we will learn about the definition, the principles of medical ethics, definition of medical ethics, and the importance of medical ethics for medical students and medical doctors, and different codes of ethics for medical professional, and ethical issues and ethical conflicts in different clinical and public health practice. The term ethics arises from the Greek word ethic. Greek word ethic is a variation of word ethos, which means distinctive habit, action, conduct of people, culture, or era. Medical ethics is a system of moral principles that apply values and judgment to the practice of medicine. We know that as a profession, medicine is thought to be the noblest profession among all other professions. What do you think? What makes the medical profession the noblest one among all? Actually, it is a way a professional doctor deals with his or her patient. It is a way how a professional doctor deals with the suffering human being. Medical profession is characterized by a specific ethos, a specific moral principle, which combined with medical knowledge, expertise, and skill plays an important role in maintaining the dignity of the profession and gives respect to the human being and increases the trust of patients and the societies on doctors and medical profession. Ethics are moral principles. We should not mix the term of ethical principle with legal or prudential or technical or etiquettes or some manners. We should remember that these habits, actions, or conducts that are practiced by doctors are governed by morality. They are governed by moral principle. These are not legal bindings. These are not technical issues. Moral ethics totally depends upon morality of the medical person, and this morality is not presumed to be natural, but people in medical profession are required to train themselves to understand the concept of morality in medical profession. That's why principles and values are developed to guide the medical professionals to develop a moral conduct towards the patients, towards the society, and towards the state. As a medical doctor or as a medical student, you should be able to distinguish between a legal binding and a moral principle. You should be able what is technically right or wrong and what is ethically right or wrong. You should know what are good manners and what are ethical principles. Here we are presenting few examples where you can decide the issue is ethical or legal, or is just a technical matter, or it's a prudential issue, or just an etiquette or a nice behavior. There is an example of a doctor who is having medical practice without having a valid medical registration, medical certificate from PMDC. It's a legal issue, it's not an ethical issue. A doctor uses, another example is of a doctor who uses non-specific or less sensitive lab tests for diagnosis of some disease. Is a technical issue. A doctor may choose some less sensitive lab tests for the diagnosis of disease on the basis of his expertise or his experience or his skills. It's not an ethical issue. Another example is of a doctor who pays to refer the patient to a specific facility is a prudential issue. For example, a doctor is treating a cancer patient and he pays to refer the patient to some specific chemotherapy center or some radiotherapy center is a prudential issue. It's not an ethical issue. Another example is of a doctor who does not greet the patient during round or in OPD is just an example of bad manners. It's not an ethical issue. Medical ethics is based on a set of values, ethos, that professionals can refer to in the case of any confusion or conflict that may arise during clinical practice. Here comes a conflict or confusion. If there is no legal binding, that is, the action is not prohibited by the law of the land and the person cannot be punished for it, then what's the importance of ethical principles for medical profession? Do a medical doctor has to consider these ethical principles? Do we as a medical doctor have to practice them, or do we have to follow them even there is no legal binding? The answer is yes. Medical ethics are values which we have to consider, which we have to practice during medical practice as a medical doctor as well as a medical student during medical education. Another point is about bioethics. Though medical ethics is concerned with bioethics, it is related to bioethics, but is not synonym with bioethics. Bioethics is concerned with moral principles related to development of biological science. It is generally more to do with theoretical ethical issues and concepts surrounding biomedical technologies such as cloning, stem cell therapy, xenotransplantation, and the use of animals in research, while medical ethics is more specific and focuses on the medical treatment of humans in particular. Medical ethics encompasses the following principles: beneficence, autonomy, and non-maleficence, justice, professional secrecy, confidentiality, respect, and human dignity. Although the medical ethics is not limited to these principles which you are seeing here, but these principles are the basic building blocks of medical ethics. None of the principles is given preference over others until and unless a competing situation arises during medical practice. Now we will discuss these ethical principles in medical profession one by one. First is the beneficence. Beneficence ethical principle says all should be done by the doctor in the best interest of the patient. That is, the patient welfare is the foremost priority of the medical doctor, and it must be differentiated from non-maleficence. Beneficence means doing good for the patient. On the other hand, non-maleficence means not doing bad or do not harm the patient. The two terms are not synonyms, they have different meanings. Later in the presentation, we will give you an example so you will be able to understand the two terms. The principle of beneficence says a doctor tries to benefit the patient as maximum as possible, as much as possible. For example, he may advise the patient for blood transfusion before or after surgery because he thinks the patient is anemic, and he may develop some complication due to surgery, so he or she must have a blood transfusion. He may send the patient to see a nutritionist or for psychological counseling. He may advise for having a counseling service before having a surgery. All these actions come under the ethical principle of beneficence. Conflict arises when physician doing for the welfare of patient health and it causes harm to the patient. For example, a physician is using morphine as painkiller in dying patient, in a cancer patient, which on one hand reduces the pain. It comes under the principle of beneficence. But on the other hand, it also accelerates the dying process by depressing the respiratory centers of the patient. That is, it seems that the physician is causing maleficence. This is called double effect. Sometimes the beneficence and maleficence are mixed in one action. This is called double effect. What the doctors do in such situation depends upon his expertise and assessment of risk and benefit. Another principle of medical ethics, an important principle of medical ethics, is autonomy of the patient. A doctor should not ignore the patient's right to control what happens to him during the course of treatment or plan of healthcare. A doctor should not see his patient just in biological dimensions. He should not consider the patient just a collection of biological system, but he should consider him as a human being and should respect his individuality, should respect his right to make decisions. The principle of autonomy says the patient has freedom of thought, patient has freedom of action, and patient has freedom to make decisions regarding healthcare procedure. His decision must be an informed decision, that is, he has the right to know all the risks and benefits of using a particular healthcare procedure. And in order to make the patient autonomous, we must inform him about the details of the procedure or details of the health plan, the risk of his health plan, the benefits, its side effect, its potential, so we can help the patient to make an informed decision. While we are discussing the principle of autonomy, there comes a situation where confusion arises. For example, if the child of a specific community called Jehovah community is suffering from major thalassemia and his parents refuse for blood transfusion, as his parents are surrogate decision maker for the child, should we respect their autonomy? Conflict arises in such situation. Here, the ethical principles of beneficence and non-maleficence will override the autonomy of parents as surrogate decision maker. There is also legal binding as the law authorized by the state to protect lives of its citizen. So the doctor should ignore the autonomy of surrogate decision maker, should ignore the autonomy of the parents to refuse for blood transfusion, and he or she must give blood transfusion to such child. When we talk about autonomy, another term comes under discussion that is called paternalism. For example, doctor rejects patient refusal to undergo chemotherapy as he knows the outcome of the chemotherapy in such type of cancer are the best. What ethical principle will override the other? Will autonomy will work here? Will autonomy will be preferred over paternalism, or will the doctor's expertise and paternalism will be preferred over patient's autonomy? Obviously, it is the patient who will undergo the treatment. It is the patient who will bear the pain and the cost of the treatment. So the patient should be the decision maker. If the patient decides to keep it to the doctor, if he trusts the doctor so much that he set aside his fear and worries and his right to make decisions about chemotherapy and let the doctor decide about the patient, about the treatment plan, then the paternalism will be acceptable. For example, a patient with breast cancer is told by her oncologist that there are two treatment options, a total mastectomy and a partial mastectomy with radiotherapy. The patient decides to have a total mastectomy. This reflects patient's autonomy. If the oncologist decides that a patient with breast cancer should receive a total mastectomy because he thinks that a total mastectomy can cure the patient of breast cancer, this is called paternalism. Autonomy will override the paternalism, or the paternalism will override the autonomy. It depends upon the patient. There comes another important principle of medical ethics that is called confidentiality. The principle of confidentiality or professional secret says that all information obtained from the patient is confidential. It is secret and must not be revealed to any other person without the consent of the patient. And here, any other means another patient or some medical staff or another doctor or even to the state. But there are few exceptions where doctor has to disclose information or doctor can disclose information. There is another term, professional secret. Professional secrets is one which a doctor comes to know in his professional capacity. Professional secrets should not be divulged except under special circumstances, and professional secrets are disclosed under privileged communication. Privileged communication is an exception to the principle of confidentiality. What is privileged communication? It's a bona fide statement made by doctor upon any subject matter to the appropriate authority to protect the interest of community or the interest of the state. This communication should be made to the proper authority without malice and should contain only the facts regarding the issue. And what are the situations where these privileged communications can be made? For example, in a court of law, where a doctor as a professional witness is asked by the court to disclose information about his or her patient, as this information may play an important role in making court decisions. And another example, for example, another example is of an epidemic or pandemic of some disease where the concerned authorities are interested in knowing what is the prevalence of this disease in some specific area, so the state should focus on that area. The principle of equity and justice says that medical benefits should be dispensed fairly. So people with similar needs in similar circumstances should be treated with fairness. For example, during this pandemic, who will be tested for COVID-19, who will be admitted for COVID-19, who will be shifted to ventilator for COVID-19 complication should be based on equity and justice. Another principle is telling the truth, veracity, and it is patient's right to know about his or her health condition. Ethical conflict arises in practicing this principle when patient attendant does not want to let the patient know about his or her deteriorating condition, for example, in some cancer patient. This principle that is telling the truth is very important in making informed decision in practicing patient's autonomy. While we are studying these principles of medical ethics, the objective of teaching medical ethics to medical undergrads is to improve the quality of the patient care by enhancing professional performance through a consideration of the clinician's values, beliefs, knowledge of ethical and legal construct, ability to recognize and analyze ethical problems, and to identify, to analyze, and to attempt to resolve common ethical problems of medical and clinical nature. While studying medical ethics, we must keep in mind few issues. Number one, medical ethics is an evolving field. Ethics are not static. They may change over time as there are moral principles, and the concept of morality may take different dimensions due to changing situation. Number two and three that is are concerned with medical ethical principles are explained in context of the scenario and the relationship of the doctor with the party, and this party may be some patient, maybe another doctor, maybe the state where the doctor is practicing. Number three point is medical ethical principles are not absolute and they are not in hierarchical position. That there is no hard and fast rule that can define which ethical principles should be given precedence over others. It purely depends upon the situation. It purely depends upon clinical scenario. In what context and in what scenario we are talking about these principles. Medical ethics is an evolving field as it reflects societal changes in values and advancement in science, occurrence of new diseases, new situations like COVID-19 pandemic, and new concepts of human rights and violations of human rights. Uh, Cases arises of violations of human rights as well as evolving laws dealing with these violations of human rights. For example, during 1930s, medicine was a paternalistic profession. Doctors gave advice and patients were expected to follow it. Now the situation has been changed since then, and now the principle of autonomy is giving precedence over other principles. Usually, during clinical practice, patient's decision is very important. Medical ethics are not absolute laws, but they can vary according to the situation. In general, ethical standard is examined in context of particular relationship between the two parties. First party is a doctor, and the second party may be some patient, maybe some other doctor, and maybe the state where the doctor is practicing. In doctor-patient relationship, the principle of autonomy, the principle of beneficence, the principle of non-maleficence is very important. While during doctor-doctor relationship, the principle of confidentiality is very important. In a doctor-state relationship, we are usually concerned with privileged communication. Doctor has to uphold each of the ethical principles. This is his prima facie duty. Sometimes in actual situation, ethical conflicts arise when applying an ethical principle in a situation or in a relationship may be considered unethical in another situation. Therefore, actual duty is determined by weighing and balancing all competing duties in a particular case scenario. As both rationality and morality is concerned, a doctor may develop his as both rationality and morality is concerned, a doctor may develop his own understanding according to his experience, training, background, and personality. That's why a professional code of conduct is set to comply with all these conflicts, but one must be able to distinguish legal obligation with ethical responsibilities. Here we are pointing towards an important point, that is, if everyone is left to make decision based on his own concept of morality and his own judgment and his own explanation of the situation and rationality of the situation, then there will be no consensus, there will be no agreement upon the moral principle. Therefore, there are some professional bodies and organizations which develop the code of conduct for a profession. Therefore, an ethical issue arising during medical practice is examined with respect to moral principle. What moral principle, what ethical principle should be given preference in the particular situation that is under consideration? What are the values? What are the moral values that should be practiced in this situation? And what are the standards of conduct in behavior and decision making? What are the code of conduct that is given by the medical council of that country? These are the code of ethics. Medical ethical principles are implemented by professional bodies like PMDC in order to maintain the integrity and dignity of the profession. Therefore, when a confusion or conflict arises during a medical practice, such as in case of attempted suicide, doctor is not only bound to legal duties but ethical duties as well. There is a list of code of conduct. You can see over here: Hippocratic Oath, Declaration of Geneva, Helsinki Declaration 1964, International Code of Medical Ethics, and Pakistan Medical and Dental Council Code of Medical Ethics. Hippocratic Oath. This oath is the earliest expression of medical ethics, establishing several principles of medical ethics which remain of paramount significance today. These include the principle of non-maleficence and confidentiality. Among all other ethical principles, these two principles are given prime importance in Hippocratic Oath. Then there comes Declaration of Geneva in 1948. It is actually a modernized version of the Oath of Hippocrates and was adopted by the Second General Assembly of World Medical Association WMA in Geneva, Switzerland in 1948. Helsinki Declaration 1964 is a set of ethical principles regarding human experimentation developed for medical community by the World Medical Association. It is widely regarded as the central cornerstone document on human research ethics. The fundamental principle is respect for the individual, their right to self-determination, and the right to make informed decisions regarding participation in research both initially and during the course of the research. Then there comes International Code of Medical Ethics. I have given the link where you can see the Code of Medical Ethics. In Pakistan, Pakistan Medical and Dental Council defines Code of Medical Ethics. Pakistan Medical and Dental Council has adopted International Code of Medical Ethics as per Declaration of Geneva International Code of Ethics, with slight modification made in accordance with religious and societal values. Then there are few conditions where ethical issues or ethical conflicts arise. For example, in cases of terminal abortion, in cases of active or passive euthanasia, in cases of organ transplantation, in cases of contraception and artificial insemination, and test tube babies, declaration of brain death, experimentation in research and clinical trials, in cases of cloning, in cases of xenotransplantation. These medical conditions and ethical conflicts that may have these conditions may have will be discussed in next lecture, and we will start what medical profession have to make decisions in accordance with the code of conduct according to the medical ethical conduct. Inshallah, in the next few lectures, we will discuss these conditions one by one. Thank you so much for your attention. Hope you are now able to understand what are medical ethics, what are its principles, and what are the importance of these principles in medical practice, and how these principles are practiced by the medical professionals in different situations under different circumstances. Thank you so much. Allah Hafiz.